We have growing numbers of older adults in Indiana. So we are here by state statute to study what is going on in Indiana with the aging population. And so we have work to do today. So calling the meeting to order. The first thing I'd like to do is do roll call. So Becky, are you on? Becky Ansbach online? Bob Bischoff? James Gone? Katie Ellman, are you on?
Good morning, everyone. I'm here.
Hi, down there in balmy Evansville. Deb Lambert, Deb, are you on?
I am on. Greetings from cold, snowy northern Fort Wayne, Indiana.
There you go. Good to see you, Deb. Jennifer,
Good morning. I am here.
good to see you. Where are you this morning, Jennifer?
I am in Whitestown, so I'm close.
Okay, you're just up the road.
Yeah.
Stephen McCaffrey, are you on this morning? Dan Mustard, are you on from Columbus?
I am here.
There you go, south of Indy. Judith Shune, are you on today?
I am here.
And you're from way up there northwest.
Yeah, we don't have the weather as bad as you guys do, though.
Oh, that's right. We got more snow than you did. Okay.
That may be the first in lifetime, but yeah.
Jake Sipe, are you on this morning?
Good morning. Yes, I am here.
Hi, Jake. Good to have you on. Margaret Smith. Megan Springer. What? Oh, James is on. Oh, okay, good. All right, James, you're on. And Kelly is here. All right, let me count. 1, 2, 3, 4, 5, 6, 7, 8, 9. We have a quorum. Whoa, great. All right. I am going to change the agenda today because we have some folks that have to go to another meeting. So we will come back to approval of the minutes and elections in just a moment, but I want to move and to bring the I4A update next on the agenda. And Hannah Carlock is the interim CEO of I4A, and welcome. Thank you.
Thank you for having me. Again, I am Hannah Carlock. I am currently the interim CEO of the Indiana Association of Area Agencies on Aging. We have had some change in leadership, so I also have Jenny Hamilton here. She is our new board chair, and then Laura Holscher is our public policy committee chair. And then we do have some legislative priorities. So we are officially in the legislative session and bills are still being made public. And so not all bills are out yet, but we will continue to keep you guys updated throughout the next couple of months. The legislative session has to end as of April 29th. So we have a few months to update you all on what's happening over at the State House. The Indiana Association of Area Agencies on Aging does have a priority bill. It is House Bill 1391. It is authored by Representatives Clear, Ledbetter, Goss Reeves, and Shackelford. It expands services of the Choice Program to allow for dementia care coaching for caregivers. It decouples the Choice Program from Medicaid. It allows the division to negotiate rates for services based on availability and access to those services. It allows for AAAs to be contracted or subcontracted for level of care assessments after the July 1st date when the state switches to Maximus. And the bill has been assigned to the House Public Health Committee. And the reason why thank you, Dr. Burke, for allowing us to move us up is because we are headed to a meeting with Chairman Barrett to ask him to hear this bill, as well as for him to educate us on what's going on with the FSSA agency bill, which does make some changes to the Division on Aging. So we'll be happy to give you an update at our next meeting on what that bill is doing. We are also following House Bill 1001 that is currently not made public yet because Governor Braun, didn't know if you knew this, we have a new governor now and he is in his first week. And so he is currently working on his budget bill and that will be made public, House Bill 1001, within the coming weeks. And that will be authored by Representative Thompson. And so we'll be working on House Bill 1001 to make sure that the choice fund funding will remain as a budget line item. And we will also be wanting to keep the 12.5 million of that choice line item that usually rolls over to the Medicaid waiver. We would like to keep that money in the choice program to help bolster our choice services. Senior Day, mark your calendars at the State House. We have Senior Day happening March 18th, 9 a.m. to 3 p.m. There will be different panels of industry leaders and legislators, and I4A will also be spending the day there meeting with legislators to discuss legislative priorities. Out in Washington, D.C., there was a end-of-year legislative package. It did not include a reauthorization for the Older Americans Act, so we'll be working with our new congressional delegation on reauthorization. However, the end-of-year package did include a short-term resolution extending the fiscal year through March 14th, and that reauthorization included the Medicare Improvements for Patients and Providers Act, which includes funding for SHIPs, AAAs, and ADRCs through March of this year. Lastly, we are excited to announce the Humana Health Horizons in Indiana grant. So Humana awarded a $150,000 grant to be dispersed by I4A to all AAAs across the state. And this grant will be used to provide eligible recipients with direct financial assistance to prevent eviction, mortgage default, and utility disconnects. This grant is for Hoosiers 60 years and older and meets certain financial qualifications, and recipients may be awarded up to $2,000 with proof of a threat or notice of eviction or disconnection. And each recipient will also receive financial management education materials. This grant ends November 30th, 2025. And that's all I have. If anybody has any questions.
Any questions for Hannah before she leaves for her next meeting?
Hannah, just a question. I appreciate you sharing the updates on the legislative, from an administrative standpoint and advocacy efforts with FSSA with all of the changes.
Mhm.
What is I4A doing to support in the advocacy around relief of the waiting lists?
Yeah, so we have been having conversations with legislators on waiting lists. I know a lot of different advocacy groups are concerned about that waiting list. I mean, that just means people are going without services. And that also means more people are trying to get onto choice because they're waiting for waiver services. So that's another reason why we're trying to keep our 12.5 million that reverts to waiver, because we're trying to serve as many people as possible with those waiting lists. But yes, that is something that we have not only discussed with the new Brown administration, but with legislators, and are educating them on that. So hopefully we can continue getting people off that waiting list. Right now, there are a lot of things happening within the Medicaid world over at the State House. Medicaid, I would say, is more of a four-letter word at the State House right now. So we're trying to educate them that it is a very needed program and that it serves a lot of different people. So we're trying to do our best to educate legislators on that.
Thank you.
Okay, well, Hannah, thank you so much. And good luck on your next meeting.
Thank you very much. Thanks for having me.
You're welcome. Okay, let's move to approval of minutes. Now, the minutes were sent out just recently, I believe.
I think so.
And I don't know if people had an opportunity to review them or not.
I have none.
Okay, what I'm going to do is say, let's file those minutes and review them at the next meeting, even though we have a quorum, because I think we need. Dan, have you had a chance to look at them?
I have not.
Yeah, we'll file them and bring them forward at the March meeting. Okay, well. Is someone asking a question online? Okay, I guess not. Okay, in January, we are supposed to have elections. So what I am going to do, we have done this in various ways in the past. Sometimes the executive committee has had a slate to come forward and sometimes not. We, at this point in time, with all the changes, decided to simply have nominations from the floor. So we we have, we need to elect a chair. We have positions for, to look at Aaron, so I do this correctly, 3 vice chairs and a secretary. Okay, so let's do this position at a time. And the only thing I ask is if you nominate somebody, be sure they're willing to serve before we vote on them. When we do it this way, we have to be sure the person's present and is willing to serve. So been in situations where that's came up before, but anyway. Okay, let's open the floor. I'm opening it for nominations for chair. And I am willing to continue to serve in this position if you want me, but let's see who else would like to serve or nominations.
This is Judy Schoon, and I nominate Joanne.
Oh, okay.
I would support that nomination.
Are there any other nominations for chair? Don't everybody jump up and down and rush. Here we go. All right, all in favor signify by saying aye of Joanne Burke being chair.
Aye.
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 Any opposition? Okay. Chair of programs. Katie, I think you're doing that right now, right?
Yes. Which is, it's had a changing role as I sent the executive committee
Yes.
yesterday.
And what we've done in that position, we've done programs in various ways. We've pre-selected them to have presentations throughout the year. When we started with the Pathways program development, that took precedent, and we spent a lot of our time on learning about and discussing the Pathways program. We also now have the different advisory committees, and with their reports, we've had chairs do presentations on what is happening with that. I'm going to say, I think whoever is taking the program position as vice chair will work closely with the chairs of the advisory committees, and we'll work with that to bring our presentations forward as significant happenings occur. We're going to have a lot of change we're expecting in the coming year with the change of administration. So that person can kind of would be overseeing presentations by the committee chairs, advisory committee chairs. How does that sound, Katie? Does that?
Yeah, that seems to reflect the history and a little bit of the direction forward. I don't
Okay.
want to put anybody on the spot, but I wonder if Jennifer Lance might be interested in that chair role. Vice chair role, I'm sorry.
Jennifer, we're waiting to hear from you.
Just threw that on me there, Katie.
I'm sorry, I just a caveat, but I mean, if
Yeah.
this is
You kind of got nominated if you're willing to serve.
As you guys, I think, know, I've recently moved into a new position at a different company. So I'm not sure I can do that at this time. I don't want to overstretch while I'm still the new one in my new company.
Okay, thank you. Do we have anyone else who is willing to serve or a suggested nomination?
I'm sorry, Katie, did you say you were no longer able to serve in this role?
I would be interested if someone else was able and interested in doing it. Our GWEP was refunded, and my energy is in a couple other places, and I feel like if there is someone else, great. If I'm also happy to if no one else is interested, I'm happy to continue if that's the group's, if that's the group's desire. But if someone else is interested, I would also be willing and, supportive of that.
Okay, I am waiting to hear. Katie, I'm not hearing anyone else step forward, so are you willing to be put forward for nomination?
Yes.
Okay. All in favor of Katie serving as vice chair of programs, please state by saying aye.
Aye.
Aye. And thank you, Katie, for being willing to do that.
Thank you, Katie.
Anyone, any objection? No. Okay, Katie, thank you. Partnerships. Judith, which one are you serving in now? Are you membership or partnership? I can't remember.
Partnership, and I really, really would like to stay there. I enjoy going out and talking to the Kiwanis and the chambers and everybody else about all that we're doing and bringing living better out there and educating some of them. It's a great position.
Okay. All right, Judith is put herself forward for continuing with vice chair of partnerships. Anyone else?
I would be happy to nominate Judith for that position.
Okay. All in favor of Judith serving as vice chair, please signify by saying aye.
Aye.
Thank
Any
you.
There was no opposition, I'm gathering. Okay, membership. Now, this is really important. Aaron, I'm going to ask you to help me here with this. We are in a position where you reached out last summer to the governor's office for those of us whose terms had expired for reappointment, and we were not reappointed. And we serve until someone is appointed into that position, is
Yes.
how this works. And we did get Stephen on last summer, and Jake came on last year. Am I missing anyone? I don't think so.
I don't think so.
And that was through legislation that happened.
Yes.
And so there are a number of us sitting here with terms expired. I don't know exactly how many, but a number of us, but I would imagine it's going to take, I don't know how long it will take for reappointments, but that will probably be a bit, would be my guess. I don't know.
And we also, there are currently 4 vacancies aside from the reappointments. We have applications pending with the governor's office that were submitted in the fall for 3 of them. So the only position that we don't have a name or multiple names submitted are the recipient of services or a caregiver of a recipient of services. That's the only application we have yet to receive.
Which I will beg our commissioners to please, let's get somebody in there. We need that voice in our commission meetings.
It can be either a service recipient or a caregiver or a service recipient.
Yes.
Okay.
It's written as a Division of Aging Services.
Okay. All right. So membership.
I'm sorry, what does that cover?
The Division of Aging Services,
Yes, ma'am.
the Older Americans Act services, choice services, RCAP, Adult Protective Services is under our umbrella, as well as waiver eligibility.
Okay, let's try to get somebody at least in the queue. Okay, thank you. Now this is because I wasn't as well prepared as I should have been. Who's serving as vice chair of membership right now? Becky is, that's right. And Becky's not on. Becky, have you joined the meeting? Okay, do we have anyone else do we have anyone being brought forward to be nominated for membership vice chair? Well, we can continue the position. I just did what I said I wouldn't do, which is the person's not here. So, let's
Move
continue.
that to the next.
We
meeting.
can move that to the next meeting because we've done what we can do here. Okay. The next position is secretary, and Dan, you've been serving in that position. I'm going to open for nominations for secretary. Dan, you can speak up. And others.
I'm happy to continue if no one else steps forward.
This is Judy. I nominate Dan.
We're trying to give everybody an opportunity to be involved. So anyway, okay. Any other nominations for secretary? Okay, all in favor of Dan continuing to serve as secretary, say aye.
I
Any opposition? Okay. Wow, we got elections done. I didn't think we'd do that in January. Hey, I didn't think we'd have a quorum, but thank you, everyone. Here we go. Great. All right, we have our officers. We did elections. Thank you so much, everyone. And as time goes forward here, we'll probably have more changes. So expect me to call a meeting of the executive committee as we move forward, because if we have to change some things we're doing, we will, but by statute, the Commission on Aging has a responsibility to act in an advisory capacity with FSSA, however things are organized to provide services to older adults. So I am hoping that however we go forward, if there's some changes with organization, we need to stay very closely connected with OMPP, because we now have so many older adults. We have the Pathways program and however else this is organized. So because I think that comes under our statutory responsibility to be in an advisory capacity to whatever entities within FSSA are providing oversight to the aging services. So that's kind of where I am, and I'll be asking for some further information on that from the division as we move forward. Okay. As of now, we have on the agenda program speaker topics for 2025. So Katie, you and I can talk a little bit out of the meeting about connecting with chairs of the advisory committees and seeing how we might proceed with that. Would that work for you?
I think that's a great idea. And then we can figure out what structure we want to follow in 25.
Okay, thank you. Okay, we are ready and we don't have to make any changes in our agenda. We're all right, and everybody's here who needs to present.
Vanessa is presenting on the multi-sector plan on aging. She's virtual.
Okay. Okay, Vanessa, we are ready for the update from the Indiana Division on Aging. We're going to talk about the Indiana's multi-sector plan on aging. And Vanessa, you are virtual, so good morning and welcome. You might be muted, Vanessa. We are not hearing you.
Okay, how's that?
Now we hear you. Great. Thank you.
Okay, lovely. I have such problems with the audio on my computer. So sometimes I have to call in with my phone just to get on the audio. So anyway, hi. I was just saying thanks for braving the weather and coming in today because I was on those roads and they're not good times. So thank you all for that. So I'm going to talk to you today about the multi-sector plan on aging. That the Division of Aging and AARP have been working in partnership on for the last, it's been like a good 3 years, I think, at this point. We were finally this past year able to get our work groups together and really come up with a solid plan for ideas on how we can make the aging environment better for Indiana. So we're going to give you just a brief overview of that today. It did get approved by the governor in December. So it was part of the governor's plan to get this approved and move forward with it. And we are going to be making that happen this year. I'm not going to read this all for you word for word. It's a wordy slide, I will warn you. So I'm not going to bore you by reading every single detail. You'll have access to the slides and you are welcome to deep dive to your heart's content. But a lot of this background type information is stuff you are familiar with. But just for a general understanding, so the Multi-Sector Plan on Aging is a national initiative. It was put forth by ACL. It was something to give us an impetus for bringing people from all different sectors of the aging environment together so that we can work as a team towards just improving what the environment looks like for people. And every state has done it a little bit differently, of course, right? Because you want to do it in a way that is true to your own state and to your own community. Indiana was among the first cohort to do this. So that was exciting. It was really fun to be one of the first to get involved with the Multi-Sector Plan on Aging. So let's go ahead and move forward and take a look at the document that we've come up with here. So what we did is we gathered several different work groups together. We'll get into that here in a minute. And our work groups helped us to develop this strategy that really, it's all these different areas of aging. We'll talk about the sectors. We're going to talk about, why do we need this and what specific areas are we looking at. ACL really helped put together a solid foundation for what kind of things we should be improving upon. AARP was also huge in this. I do not want to downplay their partnership. This is not just a DA initiative. We are the ones who put in the application. We are the ones who, got us into the first cohort. But we could not at all have done this without the work and the help and the support of AARP, who really help lay that groundwork for what this should look like. So that includes things like our key focus areas. So let's go ahead and move to the next slide. Thanks. All right, so this gives you just a basic summary of what we're going to be discussing. We've got our growing population, which I don't need to lecture you all on the growing population of older adults in Indiana. It is seriously growing. We'll show you some nice figures on that here in just a moment. And we need to meet those demands. And we need to make sure that we are prepared to offer people a stable and healthy environment for aging, right? We need to make sure that people are set up for success with aging. And in all honesty, we're not quite there, right? It's not a terrible environment to age in, but it's not as good as it should or could be. And so we really just want to level that up for Indiana. So we worked with several, when we say cross-sector, just wait till we get to the slide and we show you all the people who supported this plan and put this plan together. I mean, cross sector. We really branched out and tried to get creative, looking at different areas where we really wanted people's input and involvement. And we plan to continue forward with that. So this is not a plan that's going to be successful without continuous involvement from those sectors. So we're looking at fostering age-friendly communities. That's the ultimate goal, right? Let's have communities in Indiana. Let's make all of Indiana an age-friendly community where it's a comfortable and healthy place to age. We're working on reducing barriers. We're working on supporting what that journey looks like for different people in different ways. And another piece of it that we want to look at is reframing how we see aging and how we talk about it, the language that we use. And the partnership aspect, which I will just say over and over again, is crucial to this. This is not, we can't do this alone. There's just no way. There's no way that this could just be something the state does or just be something the Division of Aging does. Would never happen. So we are doing our best to really create some lasting relationships with our partners. So let's talk a bit about the population growth. I just really like these figures. We pulled some really good graphs for this, give a nice visual. So you know it's increasing. That's pretty obvious. Thousands. I mean, just by so much. It's, look at that, 26%. I mean, that's a wild number. We know the increase is coming. We know what that means for us. We know that we are not currently prepared for those numbers. So that is a big piece of why we need to pull this together today and not tomorrow, right? This is something we would need to do regardless. We want to improve aging regardless. Even if those numbers were going down, this is something we would want to do, is create an age-friendly Indiana. But the numbers are going up. So that really increases the importance of getting this plan out as soon as possible. Our next couple of slides are going to show you those numbers just in different forms. So this breaks it down by county, gives you an idea of how that growth is going to happen in the different counties over the next 15 years. You can see the 5 biggest counties that are going to see the largest amounts of growth. These are not small numbers, right? I won't linger here too much because you're the last people who need a lecture about the growth. You know. But not everyone is aware yet, which is why we have more than one slide to make sure that when we take this out on the road and show other people this information, that they are aware that this is a serious situation. And in our next slide, we're going to discuss exactly what that looks like. So we have this increased demand for healthcare and related supports, right? Increased support for intergenerational workforce. There's going to be an ongoing strain. And we do have the opportunity for greater inclusion here. So yes, the numbers are going to go up. Yes, that means financially speaking, that budget's going to increase, right? It's just going to. That's how this works. That means that our healthcare agencies are going to need probably more staff, and they're going to, find new challenges here. But it also means that we have this opportunity to include our older generations in a way that we haven't fully integrated yet. We have this fantastic, just glowing ball of opportunity to say, oh, look at this. This population is increasing. And it doesn't just mean that it's going to increase, a strain on healthcare or this negative idea of oh no, population's getting bigger. It's going to be so hard to deal with that. This means we also have a much larger population who can participate in our workforce in a way that brings a ton of experience and wisdom and talent. It means that we have the opportunity to integrate people into the community in new ways, to make connections with younger generations, to be able to learn from one another, to just increase that age diversity in a way that can really improve all of our programming. It can improve the way that we do healthcare, right? Like this isn't just like, oh, it's a strain. This is an opportunity for us to really take things to another level of support and comfort and health for everybody, because even though we're looking at, okay, yep, older adults increasing, that number's going up. We all know here in this room and in this virtual room, that aging isn't a thing that happens at a certain point, right? Like you don't reach 55 and now you're aging. That's not how that works. We're aging from the day we are born. So it's important to integrate all generations into this kind of a plan. All right, so let's get into what that looks like for the MPA and for Indiana. So our cross-sector strategic plan is meant to help, well, not ours, all of it, right? The MPA across the entire nation. Those strategic plans are meant to help states transform services for all of their aging populations. We are one of the early adopters, as I said before, one of the first 10. But all of the states are finding ways in their own ways to make this work for them. So for Indiana, we call it Age Forward Together. We are really looking at strengthening existing initiatives. There's probably going to be some new initiatives that we want to, crop up over time as well. But initially, we just want to look at strengthening those partnerships and strengthening those initiatives because there's already so much great stuff that's happening. We're not here to reinvent the wheel. We want to strengthen that wheel. We want to add some new spokes, get some new flashy rims, get some nice tires on that thing. We just want to make it stronger, make it better, and take those initiatives that already exist and really, blow them up, make them wonderful. We have a 10-year horizon. It was always intended from the beginning of the MPA for it to be a 10-year plan and then hopefully get renewed after 10 years. So we have 10 years to initiate the kinds of things that we have developed in the strategy. And again, said it before, I'll say it again and again and again, cross collaboration, right? Absolutely key to making this happen. A lot of those initiatives that we want to strengthen, those aren't happening here. Those aren't happening at the DA. We have some of our own, and that's wonderful, and that's going to be included. But a lot of this is also happening outside of the DA and other community agencies, even private sector, public sector. More wonderful things are happening that we just want to be a part of and want to make stronger. And then here is the slide with the partners. I don't know why I'm so excited to show you this, but I am. Look at this. Like, it's so many different areas. It's so wonderful to be able to participate with this community. Do you know, we sometimes get siloed in this kind of an environment. We're all out here doing our own thing. We're all overwhelmed in our own ways. Government agencies are overwhelmed. Nonprofits are overwhelmed. Everybody's got a lot going on. So this gives us a wonderful opportunity to share with one another what we have going on and seeing how we can partner with each other and help each other in those initiatives. So yeah, that's everybody we have working with us right now, which is just fabulous. And these are the people who put together the plan. So our purpose here with the MPA, with the Age Forward Together, is to recognize the value that this increasing population is bringing to our state. Again, it's not a strain. This is not a strain. This is a wonderful opportunity for us to create an environment that brings a richer culture to Indiana, to work together and to build a place that we look forward to aging in. We have several key goals for this that our work groups based their thoughts around and their strategies. So this is the foundation for which we built the actual plan. And it's what we're going to be looking at over the next 10 years. Could we go to our next slide? Thanks. So we have our key goals, which are broadly defined themes, and we'll get into the details of these in a minute. And then we have pillars based on those goals that outline more specific topics. And then, of course, objectives based on those pillars to look for measurable outcomes. And then the initiatives that come from those objectives. And those are the things that were developed by our work groups this past summer. This graph just gives you an idea, it's just a really great visual for what those key goals and those pillars are. So here in the middle, you've got your 4 key goals. We've got our age-friendly communities. We've got reducing barriers, reframing aging, and each journey supported. So to just explain those really simply, so for age-friendly communities, we're looking at trying to create a community that is sustainable, that is a healthy and adaptive place for people to live and work. One of the main examples that we kept giving of this as we would talk about it, within our groups was streetlights. It's such a simple little thing. But streetlights make just evenings safer, right? It makes it safer to go walk somewhere in the evening. It makes it safer and easier to see what you're doing when you're out in your community, but not everybody has them. Not everybody has a fair amount of streetlights where you can see safely and walk safely. So that's just a really tiny example of the ways that communities can be improved for that adaptability, for making sure that people have a healthy place to exercise, to move, to transport, to get from one space to another, right? And I won't go into that much granular detail in every example, but just to give you a good understanding of what we mean by age-friendly communities. And then we have reducing barriers. We are all very aware of the barriers. Transportation, I think, is one of the really best examples of this. So what can we do to make those barriers smaller? What can we do to work around them, jump over them, go through them, whatever that might look like? Reframing aging, I spoke on a little bit earlier, so just changing our language, how we talk about the aging experience. And each journey supported, that one is looking at really understanding what someone wants to do as they age. So are we moving into a phase where we do want to continue to work? We still want to be part of the workforce. We want to be engaged in, actual salary pay type of work. Are we looking more towards volunteer type stuff? And that's very individual, right? So we want to make sure that's set up for each person. If a person wants to continue to work, let's do that. How do we set that up for them? If a person wants to volunteer in their community, fabulous. How do we set that up for them? If a person just really, I've retired and gardening's now my favorite thing and it's all I want to do. How do we support that? All of those things. So trying to make sure that we have multiple paths set up for people and avoiding a situation where we are just tunneling someone into retirement or tunneling someone into just being at home and only being at home or tunneling someone into a facility, right? We want to make sure people have options for what fits best with them. All right, so let's talk a little bit more about that age-friendly communities piece. So we're looking very much at economic opportunities, and you'll see a lot of these overlap, and that's for good reason. Economic opportunities and livability factors. So these are the 2 main pillars of our age-friendly communities. So we know right now, for economic opportunity, 49% of older Hoosiers reported challenges affording daily expenses. That's a lot. That's a lot. That's too many. People should not be struggling with affording being able to afford daily expenses. So what can we do to curb that? 59% of Hoosiers age 55 and plus rate their communities as residential and commercial areas to be good or excellent, which is fantastic. I mean, that's super good news. 59% is not a small number, but we can probably bring it up, right? Like, why not bring that number up? So that's a big part of what we're looking at for this as well. Let's discuss reducing barriers. So here we have our pillars of access to information and health networks across the aging spectrum, right? Access is quite the barrier. 38% of older Hoosiers reported problems getting the healthcare that they need. That's too high. That's too high. We can bring that down. Another pillar is community supports for aging. 34% of older Hoosiers rated the availability of affordable quality housing as poor. So what can we do there? How can we, work with HUD, work with community agencies to improve those numbers as well? We want to make sure people have housing. We want to make sure people can pay their bills. We want to make sure people have food. I would like to point out that this is so much more than that, however. This plan isn't just about making sure you can survive the day. We want to make sure people are happy. The other piece of this, the other pillar for this is support for healthcare provider ecosystem for older adults. 87% of residents residing in rural areas experience primary care shortages. That's probably no surprise to you either. Primary care shortages is a really big deal, not just in Indiana. It's a national issue. We really do struggle to get a just lovely number of primary care providers. So what can we do? How can we use technology to help with that number? How can we work with our healthcare agencies to try to increase the opportunity for primary care, which we know is essential in preventing chronic issues. So how do we increase that for people? Each journey supported. Our pillars here were workforce support, volunteerism and civic engagement, lifelong learning, and community ties. So again, making sure that people have multiple options, whichever one works best for them. As someone who is 45 and still in college, I feel like lifelong learning is, whether I like it or not, probably going to be my path. I can't seem to get out of it, no matter how hard I try. I just keep stumbling right back into school. So what are all these options for people? So again, I'm going to highlight these stats for Indiana today. For workforce support, 39% of older Hoosiers report challenges with finding employment. We know we have some ageism issues happening. Sometimes education can be a barrier. Sometimes technology can be a barrier. Sometimes somebody just looks at the age and says, no, thank you. It's a struggle. So what can we do to change how that looks, to change how people see our older workforce? 31% of Hoosiers have challenges finding meaningful volunteer opportunities. That's something we can change, right? There's so many volunteer opportunities that are out there that either exist now or can be created. One of the things we need to do is deeper dives into data on every piece. But I know one of the problems we have with this is transportation, simply getting people to the volunteer opportunity. Issues with communication, making sure that we know that we are communicating properly so that people know that those volunteer opportunities are available. There are definitely some options here for how we can increase this number. Well, let me rephrase, how we can increase the number of volunteers that we have. For lifelong learning, we have 33% of older adults rated opportunities to enroll in skill building classes as poor. So again, this is a thing we can turn around. We can definitely improve the options for people to take skill building classes at all ages. This can be done. It is being done, quite frankly. And we just really need to find ways to strengthen those programs, bring them up, get them out to the people. For community ties, we have 39% of older Hoosiers report feeling lonely or isolated. No one should have to feel lonely or isolated. We can work through this. We can find ways to make sure that people have the social enrichment that they need. All right, so for reframing aging, which is our fourth key area, we have our pillars of changing the narrative and care and support. So for changing the narrative, hi Dan, I can hear you. 55% of older Hoosiers do not feel adults are valued in their communities. That's not great. We want people to feel valued. People are of value. Let's make sure they know it. 42% of Hoosiers provide 20 or more hours of care per week to another individual. That's quite a high number. So what can we do to make sure that those people have the support that they need while they're caring for others? So each of us do play a key role in supporting older Hoosiers. We have our government entities, of course, businesses, our banks, our legal organizations, community organizations, marketing, advertising, public spaces, our health systems naturally. But we have to work together to make it happen, which is the purpose of the MPA. So for our next steps, we are going to promote the MPA across the state to increase awareness and build buy-in. What you are seeing today is our initial presentation for this. We're going to do some little cleaning up, take care of some typos I noticed while I was going through it. And then we will be taking this out on the road at some point in 2025. We're going to begin efforts to collaborate with key stakeholders on implementation of plan objectives and initiatives. And of course, improve the accessibility of existing aging data and data sources in Indiana. That's going to be a really big piece of this, is making sure that we all have the right data. Because we like a number. We like to see that a number goes up or goes down appropriate to the goal that we are doing. We want to see and be able to show others the progress that is being made in this plan. So data gathering will be important to that. So how can you engage moving forward? We're going to ask people to share this with their key partners and stakeholders. See if we can get more stakeholders on board with this plan. Promote upcoming listening sessions and regional meetings. Those haven't been planned out yet, but they will be soon. And provide feedback to FSSA DA on who to engage in the coming months. So that's something that we will also be asking for so that we can pull people together. Okay, and that's all we have for today. When you receive the slides, you will see there's actually 41 slides, not just 20. Slides 21 through 41 are all deep dive information. So it shows you where we got the stats from. It gives you even more statistical data if you are interested. We wanted to make sure you had access to that information, but we didn't want to bore you by trying to read every single number on all of those slides. But if you would like to read more about it, learn more about it, that information will be available to you. Do we have any questions? Thanks so much for listening.
I don't have a question, but thank you so much. This is really amazing work you all have done, and it's fun to hear all of this and your excitement about it.
I get a little too geeked. Like, I need to calm down a little when I'm not normally this like woo when I'm presenting, but I am genuinely really excited about it.
You can hear the excitement.
Other people, comments? Well, Vanessa, thank you very much. This is an exciting plan. It's had a lot of work, and I'm sitting here. I'm looking at my pen, and it says Tipton High School, class of 1963. You all know I'm right at the top of the baby boomers. There's little. And, you know, I was reflecting back, thinking about the mid-1950s when there were so many of us, we didn't have schools to accommodate us. They brought in the trailers and put them around the schools so we could have classrooms. And it was a time also of polio. I remember it was scary to go swimming in public places. You could, people were afraid of, they were afraid of going to school. And when I went to nursing school in Cincinnati in the fall of 1963, I saw all the iron lungs that were in storage. And I thought, people had to, we're just a large cohort going through this population. And that's what we're dealing with right now in Indiana. There's a lot of us born after World War II. Polio became a public health issue. And without government funding for polio vaccine, think of all the children who would have had died or been disabled from polio. And so we had funding for polio vaccines. Our age group, our age cohort, we have contributed greatly to economic strength in the United States over the years and still do. Now, some of us are outliving our money, so we're going to need some help. That's also true, but we have contributed enormous amounts of money into the economy over our lifespan too. So, I mean, I think this multi-sector plan on aging, I get excited. Vanessa also, just thinking about it and looking at it. And I'm going to talk about it a little bit more when we get down to the advisory committee reports. But, this is really important. We need to think about all the things that we need to deal with. And, it's going to cost us more money to not become age-friendly, I think, than it will if we do.
Yes,
That
ma'am.
was on the polio story. So we need to think differently and help our legislators understand that a little bit more because, and the other thing with age-friendly communities, when we develop, better walking, better lighting, better whatever, it helps all generations. It's not just one. So, and we have a fantastic area agency on aging network here in Indiana. We have a lot we can build on our strengths. We also have to know that we've got some areas where we've got to deal with, it's going to cost us a little money. Like there's a lot of us who are going to get dementias. We don't have a cure for that yet. We need to be sure our state plan is supported well. There's a lot we have to advocate for. But thank you, Vanessa. It was wonderful. Your energy is around that. And we can't legislate this age cohort away. We're here. And we're not going to be quiet. And we vote. And so do our families. And I'm just saying that because we are here. We're not silent. And we won't be. Look at the things we've done over our lifespan. You want me to start? No, I won't. So let's just be prudent as we step forward. And some of us are going to be very active in advocacy and need to be because it helps all our families. It's an intergenerational issue. All right, I've preached enough and I need to be quiet. Okay, well, thank you so much, Vanessa.
Absolutely. And Dr. Burke, if you don't mind, I might actually run with that polio example in future presentations because I think that's a really good and still very relevant example.
That would be fine. I think we need to better understand the implications of not addressing what's going on.
Yeah.
Thank you.
Thank you.
Okay, next on our agenda is FSSA and Division of Aging updates. Okay. Who's going first?
It's gonna be Pathways update, if that's okay.
Okay, well, thank you, Kim.
My name is Kim Brimmer. I am the Director of Pathways for Aging Program here in FSSA. We are just gonna go over quick updates on just make sure that you're aware of all of the things that are going on with Pathways. We'll start with an overview. We'll talk about our notice of action. We're going to talk about the timely filing extension, talk about our temporary emergency fund assistance program. We'll touch base on the wait list, as well as just talk about the MCE oversight that we're doing. So next slide, just to level set to make sure everybody is aware and to give an overview of Pathways. Pathways for Aging is a deliverable systems for managed care entities to coordinate medical care and long-term care support for those who are enrolled in Medicaid in Indiana. This program is for Medicaid eligible Hoosiers that are over 60. I think everyone's aware of that. We are working with 3 MCEs, Anthem, Humana, and United Healthcare to participate. We are want to make sure everybody is aware this is not just state plan Medicaid, but it also incorporates that long-term waiver, or past was age and disabled waiver services as well. So one of the things that we're working on right now is we've realized each of the MCUs, their notice of action that was available or equivalent to an authorization were not a uniform format, and it was very confusing for the members to understand what services they were getting authorized for, as well as providers. And so we went back to what was done previous to Pathways and took out that template, and then have instituted for all 3 MCs to mimic that exact template. So as of this month, they should be seeing the same for all 3 MCEs, as well as in a format that they're used to. So, and here's an example we were just showing, it's tabled out. We're making sure that components as well as the time frame of authorized units are done in that monthly components instead of a lump sum. They will definitely clearly state which services that the member will be getting and what provider will be giving those and how many units they will be able to provide. So we're really hopeful that that will definitely dissipate some of the confusion around the authorizations. Another component.
I'm sorry.
Oh, sure.
Sorry. Stupid question here, but that you mentioned that being updated as a deliverable for the service recipient. I'm assuming it's for the providers as well.
Correct. Yeah. So the version a little bit different. Providers will only get their services, but we'll be still doing the same thing for the participant. Well, they'll get all the services on the one service plan, but both of them are initiated, and all 3 MCs have started this month. We are hoping it would be completely inactive this month as of January 1st, but we're still having a couple of glitches, but they will be all by the end of next week. So any new authorization should be in that format that would be the same as what they would be getting from Gainwell. So fee for service, and all 3 MCs will have the same format. The next thing that we are addressing was timely filing. Obviously, launching a new program makes it that there are some billing situations that may have caused a little havoc and not getting done in a timely manner. So the timely filing was supposed to be a 90-day timely filing process. And we have extended that timely filing extension to the end of this month. So as of January 31st, the timely filing will expire and we'll go back to that original timely filing period. But for any claims that have been submitted or in process, we are extending it and making sure that all of those are worked through. So any providers that were struggling still have time to get in any services that they have already been provided that may have not have been put in for billing for some reason or another, and they will still be able to get paid for. So we're, and we've been watching that. We thought we've extended it an extra month because they're providers, but we work with a provider targeted work group to ensure that this is still an okay timing. We would expand it if it was necessary, but we're not feeling the need for that. So we're thinking we're able to capture it, that all providers have at least submitted the claims so that that timely filing period doesn't need to be extended past this.
What's the primary driver behind the challenges that providers are facing with billing?
I will be honest, it's a lot of EMR setups that to work with the MC. So it's the EMRs getting set up to communicate with the MC's platforms to make sure reading. We have a couple components that have had us hiccups that Gainwell had some behind the scenes acceptance of claims that were being submitted under the MPI versus the LPI, some other nuances that were crosswalked in the back that we were not aware of, that weren't in the manuals and were not there, that they had done just to help. And so those are some of the hiccups that we've had with that. Some of the things like providers aren't used to putting their taxonomy code on there, little things like that that has caused that. We work on it. We have a claims meeting again today. We work with the providers very closely. We ask all providers to send out any of their hiccups that they're having or any issues so that we can work with the MCs directly on all of these. So we've kind of worked through a lot of them. We still think there is. I think one of the other components was the Medicare, Medicaid crosswalk was definitely not anticipated because our state is set up significantly different than the other states. And so that denial process, having especially home health providers not used to, submitting a Medicare claim first and having that move over, it's set up for the system to do it, but the provider wasn't, familiar with that. So we've done a lot of education around that.
And what is the overall impact to delivery of services? Like if these providers are having billing challenges?
Yeah, so far we have not seen a significant, we're the MCs, and we'll talk about that emergency fund, assistance fund program has been one of the components, but the MCs have really reached out to assist providers in getting some sort of payment so that they can continue giving services. Anytime we feel like there is any jeopardy, the state has stepped in to work directly with the MCs, and the MCs have been very, very conducive to help. They do not want to lose providers. They do not want to lose services. So we've been very diligent to ensure that that isn't happening. I'm not saying it couldn't have happened. I'm just saying any notice we've had, we've been able to stop it. So I don't see that that is a big issue from at least the billing side. Eligibility is always going to be a concern, but that's something that's not anything new.
Yeah, I've heard a lot about the Medicare, Medicaid issue, right, for those home health agencies and the challenges they faced there. So
yeah,
denials on prior authorizations and all
yeah,
this.
and most of it is because there are so many home health in the state of Indiana that are not Medicare certified, that are Medicaid certified, and that's a nuance that only Indiana has. I've worked in multiple other states. Home health is my area of expertise, so I've worked in many other states, and they don't have that problem because they don't have that availability to do that.
Interesting.
So the next slide we'll talk about, we also have working with the temporary emergency financial assistance program that was done under the Senate bill requirements is to expire at the end of January. As of today, or as of January 10th, we had 295 applicants to that program. We have noticed that we are closing those applicants. They may not have been accepted for it. We close them for providers, and the MCs have already resolved the issues, so we would not have accepted it if that happens. Denial of claims that are currently being reprocessed, so we're not accepting a TFAB application for something that we feel like are already in progress to get paid. Anything that would have insufficient information, we've gone back to providers several times to get more clarification to ensure that it is something that we could justify giving that TFAB services for. And then duplication of applications. We have multiple providers that are applying multiple times for the same issues. So that would have been reasons we would have closed that application. Common denial reasons, the reason why we would be denying is if a provider did not complete claims testing, one of the main requirements of this is the provider would had to put the attempt in to have learned the claims testing, have successfully completed claims testing. If they had not done that, then those providers would not be eligible for this, as well as some of them would be that they were put the reason for the TFAB. One of them was saying that they had excess of $25,000 of unpaid services. And we found that oftentimes that can't be justified. So maybe they put it as a wrong reason. Or there was no claims that had been submitted to providers. Surprisingly, there was a lot of providers that were putting in for TFAB, but hadn't actually billed the MCE for the services. So those would have been a denial reason. OMPP operations is definitely monitoring this. We've worked significantly with the MCEs. So oftentimes if they do not get a TFAB approval, the MCEs would be reaching out with those providers individually to ensure payments. That is where we're hearing that they're not stopping services.
Yeah.
Next, we'll kind of breeze. We have the wait list updates. We're just kind of doing this and this is something that we're always working for. I'm knowledgeable, but not as knowledgeable as others. So I'm just going to kind of give you a brief overview. We have the H&W waiver. We have it broken down on this, and you can see this also on the website. We keep that updated where we are giving those invites out. So as you can see, we've had over 2,396 invites coming from H&W on a monthly basis, but all the way through to the end or to January at this point. We're working off of people who have gotten off the wait list invites up to April 18th of last year, or those are being processed through. That means that those invites are still being worked through for eligibility purposes and trying to get those services started as quickly as possible. But we have scaled up those invites. Pathways, do you want to move to the pathways? Next slide. Okay, so the pathways is a little I'm more familiar with. As you can tell, we're really monitoring the wait list invites. We started at a smaller amount at about 850, but we've scaled up significantly this month. We've been at 2,000. We're trying to really scale up and get as many people off the wait list as possible. We work diligently on this wait list process to find out what is holding up these people to get off the wait list, not only the invite, but also to get to services. So we work with the AAAs, but also we're working with the MCs and really keeping a strong, close line of sight of what we can do to help advocate to get these members services. We have make sure we highlighted and really focused, and we even do a weekly meeting to ensure those transitions from nursing home to home are being highlighted. We're doing the prioritizing for those people who are coming out of the hospitals. We want those people to be able to get back into their homes and do that. All the MCs get a regular updated list of all people on the wait list, and they are working with them individually to see if other community resources are available for them or if there's other mechanisms that they can get services on. We also are looking at in Indiana for the waitlist people, the MCs are looking at PA services for those people that may qualify instead of looking at it as silo as we had done in the past. So a lot of these members, while they're still on the wait list, if they are active with the Pathways MCEs now, are getting other support services. So that's a hopeful thing that we've noticed.
Kim,
Next,
I
go-
vaguely remember is there some pending litigation on those individuals in assisted livings who?
There is pending litigation, and I'll be honest, I'm not in charge of that. It was
Yeah.
regarding 5 members about the service getting in.
Okay.
I know that we do have a special assisted living grandfather group that we've been working on and getting them out of, or, if they're in the assisted living, we don't want them to lose their assisted living home because of the wait list process. And we've escalated those to get those through a grant program so that they can stay in their home setting. Those people who were on the wait list prior to, or had on the wait list prior to go live with Pathways. So we've really worked with those. So we're not getting the emails back for that. But yes, there is some litigation, and I'll be honest, I'm not familiar enough. That's not my area. I try to stay away from.
And I believe in the waiver amendments that are pending right now, they're out for public comment. Is there a special allotment of slots for assisted living that's been written? into
No,
those
only
waiver
through the
agreements?
grant that there was.
Through the grant.
Yeah. Are you familiar with that? Oh, okay.
Okay.
I'll let you
Is
talk.
there some place to get a summation of those CMS modifications that have been submitted? I clicked between Christmas and New Year's to start reading one of them, and it was 277 pages long. I burned out at about page 50 something. So is there some place that can give like a meaty summation of those?
There are some webinars that are
Yes.
happening over the next week or so. We can send out the link to all of those. I think there's one more, but if I'm not mistaken.
Yeah, there's the one
Yes,
this
there's one
afternoon.
today. I think there's one more. And then we'll have a video posted.
I have no idea what was just said.
Here is that they're hosting waiver seminars, amendment seminars. There's even one
Yeah,
later.
and
they're
I've been
posted
on one of
online and
those,
back-
and all they
back
do
is-
is, yeah, so they just give you a link. So you're saying the summations are on those links, or that's a link to the 277 page document?
Well, both. They're giving you, those webinars are summarizing all the changes.
No, ma'am, they're not. I've been on them already. There was one earlier this week. They literally just give you the link. At least the first one didn't. I've only attended one.
I will take that back and see if we can get some more clarification and make sure there's some communication posted both on the Pathways as well as on the H&W website. I do know the H&W website does have links to more details. We're still getting our update for that on Pathways.
And we also have some slides that were presented at the DDRS Advisory Council just this week, so we can also get those and share those, which have more of a breakdown and some more information on what is happening with the amendments.
Yeah, I mean, I think for people, which is most citizens of Indiana, that don't really write those documents, nor do they ever typically read them, they're not super easy to read and understand what the changes are going to be or what the changes are proposed to be. So if they're asking public comment, I think there's probably a way to make that process more transparent. And I've not found that process or that way yet. And I'd like to see that. So yeah, if you can get any information out to us, that would be fantastic. Thank you.
There is somewhat of a summary of the proposed changes to that 271 page waiver amendment. I don't know if it covers all of the changes, but there is a summary at the beginning of that waiver amendment that attempts to cover what the waiver amendment is proposing.
Okay, well, I'll re-review those documents, but thank you. And if in the meantime, if you find any more, I would greatly appreciate that information as well. Thank you.
So I'm going to wrap up and just kind of do an overview of what the MCE oversight that OMPP is doing. We want to make sure that everybody is clearly understanding that we get quarterly and monthly reports from the MCs, as well as we're doing weekly reports on the MCs. And there's areas here that we're really focused on. They are cited for liquidated damages, everything from 2,500 up to $50,000 in liquidated damages if they don't meet these criteria. And I have kind of outlined here to help kind of give a guide of some of the components that we're looking for. We also have performance measures that we're monitoring very closely. We put the MCs on a correction action plan if they are not adhering to the levels that we're requiring for that, as well as working with them very diligently to ensure, and then they get other penalties if they do not. At this point, we've gotten, if they're not in the range of the level that we're targeting, they have to meet with us on a weekly basis to get it up to that range and give us detailed information on what their process changes are to ensure that we get to those levels. So we're really looking at anything where there is some problem areas and ensuring that the MCs get to where we need to be. Any other questions on pathways before I pass it over? Well, we
I do have
appreciate-
one additional quick question. I'm sorry. We had a case manager come into our community this week and she was really excited because she said all waivers are being combined into one. She was just told that at a meeting and it hadn't been announced yet to the public at large, but she was excitedly telling our move-in coordinator that information.
Yeah.
So I'm just curious, is
I got
that?
an email asking the same question. That is not anything that's on our radar. So I'm not sure if we're just not in the loop, but no, the pathways waiver is definitely separate and H&W waiver is separate, and there's no plan as of my knowledge of any movement on that. We'll let you know if it is, but
Thank you. I appreciate that.
no problem.
I just want to say something, a positive comment on pathways before you leave or while you're here. Because we've asked a lot of questions and it's been a lot of up and down over the last year and a half now, I think. It's been a while. I had a friend who applied a year ago in September. This started, and of course it's been through all this transition and they were having a very hard time understanding, et cetera, et cetera. They just got services this month. And I thought, she said, I'm going to call you and let you know what we're getting. We've been approved and will be the MC. I'm not going to mention who it is, but it would be out and we're going to get our services started. And I thought, oh, wow, because I've had to talk them off a cliff a few times in the last year and a half. And I thought, oh, my expectations were, they weren't real high on how many hours they get, although she has advanced dementia. She has Alzheimer's, and by this point in time, she's needing almost total care. And the family just burned out. They couldn't get respite from a nursing home because she had pending Medicaid that would take her, and it's been quite an up and down. She got, I would guess, pretty close to, well, it was a lot of service, a lot of hours, and they're so grateful. It has come through. It's been a long wait, and they're really, really grateful. And I was pleasantly surprised with the support that family's getting. And it makes me think they probably will be able to continue for her to live at home until she passes away. It is now adequate support for them. So that's a positive story. And I know we've had, it's happening.
It's good.
And we need to acknowledge that in our meetings too. So it does happen. It's just they started all this at a particularly difficult time as we went through all the transition. So my hope is as we move forward, all of this will be a bit smoother for families as we all know what's going on. But yeah, just and another shout out for how much we need to keep paying attention to dementia care in Indiana and supportive families. So anyway, thank you. Thank you for your service. Thank you for working on all of this. Do we have any further updates? And I have some questions but go ahead. Erin's going to give us a further update.
Yes, I have a few general updates from the Division of Aging. Within the Division of Aging, we're really focused on continuing our day-to-day responsibilities to our programs, to the individual we serve, to our stakeholders as we're working through our leadership and the administration transition. Kelly Mitchell, the current director of the Division of Disability and Rehabilitative Services, will be acting as interim director and supporting the DA as we're going through the coming weeks and months of the transition. So we're looking forward to working with her. There are a couple of areas that I wanted to highlight. We had been asked about the status of adult protective services, and through the end of the state fiscal year, the program will continue to be with the prosecutor's office, and then starting July 1st, the program will transition. The request for proposal or RFP process is ongoing, so we don't have any updates to share at this time, but the transition is supposed to happen July 1, but we're in the middle of the process.
Okay, thank you. I had asked that, and I know Judith had a question about it, and with all of us who are baby boomers, we are going to need a little assistance with that area. That we know.
So when we have more updates to share, we'll be able to share. We also have been very busy for many months working on preparing for the next cycle of the area plans on aging, which are 2-year plans that are a federal requirement of the Older Americans Act that the AAA submit related to their designation as the area agency on aging for their designated counties. So they talk about planning processes, future activities, goals, objectives, assurances related to alignment with the federal regulations. The current plans were submitted in 2021 for federal fiscal years 22 through 23, and then we updated them, or the AAA's updated them for 24 and 25. So we are working on issuing the guidance and templates for federal fiscal years 26 through 27, which will start in October. And as we're working on the guidance and templates, we're really trying to focus on one, alignment with the Older Americans Act. So we've talked about in previous meetings, the regulations were updated this year and we're supposed to be in compliance by October 1st. So we're making sure what we can do at this time to reflect any changes in the regulations are incorporated into the plan, as well as trying to focus on alignment with the goals of the multi-sector plan on aging, Age Forward Indiana, that Vanessa was talking about, as well as our state plan on aging. So we're trying to make sure, while there are these distinct plans that are required for various reasons, that we are in alignment. Oh, and I didn't mention the dementia strategic plan as well. We just want to make sure that as we have these different plans, that we're all moving forward cohesively as much as possible. So we're hoping to get that guidance and templates issued within the next couple of weeks. The commission does have a role in reviewing those plans, and we are planning to do so this July. So I will be working with Dr. Burke to try to plan through the process and what that'll look like for this cycle.
So how does the dementia state plan fit in with the area agency plans?
So there are, and I won't go into the weeds too much, but there are certain areas and priorities that we're required to address in the area plans per ACL guidelines, and care and services to individuals with dementia is an area. And so when we're structuring our questions that they need to respond to in their plans, we want to make sure that if there are opportunities for alignment or areas where they can contribute to that plan, that we can
Okay, that needs to be addressed, but the funding for the dementia state plan is where?
I can't answer right now. However, there are requirements in the Older Americans Act that, in looking at the Older Americans Act funding, that be a population that is targeted. So it's that balance.
Well, didn't Hannah speak to legislation that I4A is supporting to ensure some funding for some dementia
Mhm.
care through the AAA?
In the specialist program.
The specialist
Mhm.
program.
And I think Kim Woods is here who currently manages that program. So yes, so
Okay,
Okay.
so it's going through that. Okay.
yeah.
All right.
Um,
Questions for Aaron? Kelly, I'd like to say hello to you coming up, if you don't mind. I know you're new, just interim, but can we say hi to the commission? Thank you, Aaron, very much.
Thank you.
Hello.
Hi.
Good morning. I'm Kelly Mitchell. And as was stated, I'm currently the director for the Division of Disability and Rehabilitative Services. I've been with the state a little over 3.5 years. I'm the other bookend of the baby boomers. I'm the tail end. So I've spent about 38 years in the industry working with individuals with disabilities and Hoosiers as they age. So it's been my passion for a lifetime. And I've worked with a lot of the team members in the Division of Aging and the former director in my current capacity. We've collaborated on a lot of projects, so very well aware of all the services and activities under that umbrella. But I am going to be spending some time just connecting with the team, making sure that I'm fully aware of all the current initiatives and programs and processes that are in place.
So currently, as of very recently, I would think you have assumed the responsibilities of interim director of the Division of Aging,
Yes.
like
This
within a
week.
So I'm not trying to put you on the spot.
Yeah,
I
so
just wanted to say
it's-
hello. And
yeah,
be sure
nice to meet you.
the commissioners are aware of who you are.
Yeah.
And thank you for taking that on. As you know, one of the things we want to be sure that continues to happen is that we continue to hear from OMPP in our meetings. Just because Pathways is over there now, and that's a lot of our older adults and services, as well as hearing from the Division of Aging. I think I've said that 10 times, but I think it's really kind of important because this has been shifted in the last 24 months. As we relate a little more broadly within FSSA than we did. We were more just attuned to the Division of Aging, and now things have changed a bit. So. Okay, thank you. Do you have any questions for us?
I don't at the present time. Thank you.
Oh, we're trying to work in partnership and as best we can in our advisory capacity with
Yes.
with aging issues. Any other updates or thoughts on FSSA and any reorganization of anything? Is there any updates on that? No.
Nope. We're just really in that period of transition. So.
Okay, very good. Thank you.
Thank you.
Okay, we are ready to move into our advisory committee reports. And the Living Longer, Living Better Collaborative. We worked on that. I did a pilot project up in Tipton County years ago, and a lot of the work we did is work that was done on the multi-sector plan on aging. And I'm beginning to wonder here if this is not an advisory committee that could begin to work more closely with FSSA as you go forward and bring some folks there who are working on some of these initiatives across the state into that advisory committee. And then again, act in an advisory capacity. Kind of thinking about it. And anyone that wants to comment on that, I'm open to that because the multi-sector plan on aging is really important. I think some of the dementia pieces are going to come in under the family caregiver advisory group, but some of these other issues, reframing aging, some of those things are not specifically in some of these other committees. Any thoughts from any other commissioners on that as I think on that, or any suggestions you have? Anybody willing to work with me on this a little bit more? If not, I may call you.
This is Judy. I'm always willing to help.
Pardon?
I said, this is Judy and I'm always willing to help.
Okay,
And yeah, this is Deb. I'm interested to learn more about what you're thinking with that. So yeah.
well, it's kind of a work in progress in my head, but I think we need to have some follow-up on what's going on with the governor's multi-sector plan on aging. It's a well-developed plan. And we need to, I think, have act in an advisory capacity to FSSA, however this goes right now, to the DA on this. And so, okay, I'll be talking with you, Judith and Deb, and we can go from there and see if we can't get some folks that are working on some of these issues across the state onto that advisory committee, and anyone else who's interested. Okay.
There's a comment in the chat from Vanessa that says that would be amazing.
Okay, well, we're trying to work in partnership. Great, Vanessa.
Dr. Ellman said she is interested as well,
Okay. Oh,
especially in how these initiatives align with WEP and the Dementia State Plan.
okay. Okay, all of that's part of it. Great, thanks. I'll be in touch with you. Okay, the Shared Decision-Making Advisory Committee. Judith, do you have any update on the report?
Well, unfortunately, we're put on hold. The courts wanted to wait to see what Adult Protective Services was going to look like going forward. So right now, we're just waiting to see what's going to happen.
Okay, we'll be waiting. Apparently that goes over to the DA in July, so. All right, emergency housing, Deb Lambert.
So we've got a memorandum of understanding put together. The holdup right now is apparently Byron Health Center doesn't have the right number or something to execute the memorandum of understanding. So we're in the process of accessing and getting whatever number it is that we need, that the state needs for us to be a partner. And so once we get that done, I think we are going to be moving forward.
Okay. That is an important area of concern that we need to keep an eye on. So thank you, Deb.
Yeah, thank you.
Family caregiving, Kelly.
Yeah, well, fortunately, my computer lasted long enough to get right to my update. So to refresh my memory from notes, we last met in October, and the group had decided that we would move. We'd been meeting monthly since I think March of 2024. And the group decided that we would move to quarterly meetings. So our next scheduled meeting is the end of January. Dr. Burke, if you remember during our last meeting, we put forward through that meeting, we created a number of questions that we advanced to Leslie Huckleberry. And she did respond that the state at the time was working on a written response to us because there were, as I mentioned, a number of questions. So I don't know if that's something, Aaron, if you have any insights into whether Leslie made progress on that, or I'm happy to reshare that and dialogue with you about the likelihood of us getting responses, I guess. I'm just given the changes.
And let you know.
Okay.
If I can find information I will share.
Okay.
I'll follow up.
Okay, that'd be great. I think other priority areas for us were as a coalition identifying family caregivers and or individuals who've been added to the waiting list to share their stories with AARP, who has or is in the process of putting together for the upcoming legislative session some of the stories about the impact of the waiting list on those individuals to use in their advocacy with legislators going into the new fiscal year. So I'd say off the top of my head, those are two of the big areas. And obviously we'll revisit perhaps the frequency of meetings with that group in our January discussion, just given all of the changes happening inside FSSA. So that will be an agenda item.
Okay, thank you, Kelly. Dan, housing supports.
Yes, I put a link in the chat for the report that I'm sure a lot of you are familiar with, the State of Aging in Central Indiana report that was funded by the Central Indiana Senior Fund. There's some great information in there, and I posted that because much of the information there about housing, and this is the link to the housing page there, is even though it was done for Central Indiana, it really reflects what's going on in most of the state. There might be a few differences in some of the numbers, but in general, the trends are the same. And I think most of us are aware of it. There's a lack of housing, a lack of affordable housing in particular in most places. There are a couple of key points in there that I found really interesting. Number one, and it's something that we had not really discussed, and I hadn't heard a discussion about this, and that is the debt load that many people are now retiring with. A lot of folks are going into retirement with increased debt. So that kind of piggybacks then on the fact that the number of people, and in this study, and I would guarantee that it's very similar in other parts of the state, that more than half of older adult renters are burdened by housing costs. And there's a kind of a criteria for that. But essentially, one in particular that almost 70% of the renters who are over the age of 85 pay more than 30% of their income for housing costs. So, you know, that's pretty significant. And I think that might point to the fact that we will need to, you know, as a state, look at the threshold for assistance for housing. You know, right now that threshold might be, you know, higher than it should be in terms of income. Like, you know, we're looking at some probably old numbers for income that, with the rapid increase in rent and costs of houses, is probably not keeping up. So that's something that we'll have to take a look at. The other stat, and I have heard this in commission meetings, but it bears repeating, that a third of the homeless folks right now are over the age of 50. So that is, you know, certainly an issue that we'll have to look at moving forward. You know, just the number of people who are, you know, not only getting older, but living longer. And so when we look at people over the age of 85 who are renting, you know, that's a fairly new phenomena, that we have folks who are, you know, not just the sheer number of people, but also the fact that we're living longer. So yeah, it's kind of a 1-2 punch right now when we're talking about issues for older adults. I believe that's the highlights there, and I have included that link. So I would encourage people to go and take a look at that report. There's a lot of great research in there, and it's a great capsule of what's happening, you know, not just in Central Indiana, but I think most of those trends, people would agree, are throughout the state. I can move to the Senior Center Coalition report. Our next brown bag is going to be on January 24th, so a week from tomorrow. That'll be at 12 o'clock. And I'm going to go ahead and put my email address in the chat as well. So if you know someone who is part of the Senior Center Network, or someone that you think might be interested in participating in the brown bag, this one will be focused on the topic of fitness programs, fitness and wellness programs in senior centers. But again, you know, a lot of these programs are not just in standalone senior centers, but also YMCAs and other community centers that also have some senior focused programming. So I would encourage people to participate in the brown bag a week from Friday. I can send the Zoom link, so I've included my email address there. You know, what we're going to be talking about is not just fitness and wellness programs that have worked, but the ones that have failed and why. which are the ones that are the most attractive to people, and we find over time are the most successful and well attended. And hopefully we can, help people get some ideas about how they can duplicate those programs. Because we know that social wellness is incredibly important. And that's usually a key focus of senior center programs, but also, strength training and stretching. And, there are a lot of other ways that people need to continue to work on their physical health as well as their emotional and social health. So we're going to be talking about those programs. And then we're have a conference that will be coming up in April. There'll be more details on that as we get closer, but that will again be in Tipton, in Dr. Burke's backyard. So, well, not literally her backyard, but close. And we will have a day conference, gathering senior center leaders and staff from around the state. And I'll share some more details as we get closer.
Well, Dan, I was just thinking as you were talking, I'm so glad we've been able to bring the information from senior centers into the Commission on Aging meetings. Senior centers play a very vital role in the health and wellness of older adults in Indiana. So really, really happy that we're able to do that. Thank you very much. It helps a great deal.
Oh, thank you for giving us a place at the table.
Dan, it's Kelly. I'm not going to have access to the chat. Would you mind emailing me a link to the senior fund report?
Yeah. Yep.
That'd be great. Okay.
Okay, I don't have this, I don't have a link. I could send a link out. The Commonwealth Fund has their 2024 report on healthcare in 10 of the wealthiest countries in the world. And I just encourage people to take a look at that. Unfortunately, the United States is an outlier in terms of we're spending more than any of these wealthy countries per capita, and our outcomes are only mediocre at best. We have the highest number of preventable deaths, and our longevity is shrinking. So it's just something I think we need to be aware of and share that information with people. There's some things we need to take a look at in the country in terms of what's happening. And one of our biggest problems is access to care. And it's how we've set things up, and it's costing us a lot in terms of human suffering, death, and as well as cost. So, one of those things we just need to be aware of, I think. But I really encourage you to take a look at it. It's worth a look. Okay, everyone. Wow, we're done 15 minutes early. So, well, thank you, everyone, for all the good work that's going on across the state of Indiana. We have a lot of change going on right now. There's a lot of need for some strong advocacy right now. I think that's the best way I could put that. Helping people understand the benefits of caring for all ages in our population. And right now, you cannot legislate away all the baby boomers. Doesn't work. We're here. We're going to be vocal, and we vote. So anyway, let's continue to work together, and want to give a shout out to our folks that are working in the AAA network, state dementia plan, and state government, and at FSSA. I know you're going through a lot of things right now, a lot of changes. So we continue to work together. Thank you, everyone. Glad for your advocacy, for your service on the Commission on Aging, and to all of you that are online with us. Wow, maybe in March, it'll be balmy in Indiana. What do you think? I doubt it. We never know. But anyway, see you all in March. Thank you.
Dr. Burke.
Thanks, everyone.
Dr. Burke, this is Judy Scone. Can you hear me still?
Yes.
Okay. I just wanted to say thank you for staying as our chairman for this next year. I know you got a lot going on. There's a lot happening in the state, and I just wanted to say thank you very much.
Well, you're welcome. As I said, you know, if I get to the point I'm at the top of the baby boomers, I can't do this. I hope all of you gently help me get out of this place. But until then, you've got me, and I'm a pretty passionate advocate. So there you go. Thank you so much for your kind words.